No, we used to do some very coercive things in the treatment of eating disorders. There was well-meaning ideas that forcing people to eat or to gain weight rapidly was going to somehow accelerate their recovery from the eating disorder. And we know that those things really don't work. In fact, they can often be traumatizing. So one of the most important innovations in the treatment world for eating disorders has been the introduction of the idea of mobilizing the autonomous desire on the part of people to make changes, changing their thinking that supports their problem behaviors, cognitive therapy, if you like. It's true at the same time, though, that we have a long way to go in terms of understanding how to be really effective in helping people recover from eating disorders. A good number of people still continue to have eating disorder symptoms after the best available treatments we have, at least over the short term. I'm convinced at the same time that you never have to accept to live with an eating disorder. Over the longer term, going back and taking it on again and again sometimes is the route to recovery. The genetic and epigenetic kind of, or genetically informed models, I can't say, it's a little premature to say that they're going to revolutionize treatment. I mean, they do promise the potential of epigenetically relevant interventions, either pharmacological ones that could switch on desirable genetic tendencies or switch off the adverse ones that the disorder might have created, maybe nutritionally related interventions, reestablishing the proper nutritional status of the epigenome could be something that undoes what we believe to be epigenetic processes that kind of anchor the problem in somebody who develops the eating disorder and then through chronic dietary problems, maintains it. But you know what? Even before we go into that kind of science fiction-y stuff, which we're not quite ready to implement yet, I think there have been immediate applications and implications of genetically and epigenetically informed models. In a weird way, the biologically informed models, I think, humanize therapy. They help us understand that people don't develop disorders because of capriciousness or oppositionality or because they have some kind of terrible weakness, and it's not due to parental failures. We're talking about disorders that occur in people because of real vulnerability. I often say to my patients, you were walking along the sidewalk when the movers dropped the piano and it hit you. You didn't ask to be hit in that way, and now your responsibility nonetheless is to kind of undo the damage that the piano did. And in that sense, I think it really helps challenge what is a basic component of just about anybody I've ever met who has an eating disorder. One of the fundamental symptoms is shame. And there's always a feeling of what's wrong with me that I developed this problem? How come I haven't gotten over it yet? Families say, why did I do this to my daughter? I shouldn't have dieted when she was a kid. And an epigenetically informed model helps us as therapists and people who are around people who've developed an eating disorder understand that it's not that kind of thing. We're talking about really complex crosstalk between environments that do things and hereditary potentials.